Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Retrobulbar block, we're looking at the complications as well as the contraindications. So first we begin with the complications. So here in the complications, it may be due to the retrobulbar hemorrhage. Retrobulbar hemorrhage. So this is the most common complication. Next is, it involves a subconjunctival hemorrhage. For the subconjunctival hemorrhage, then they can also be due to the proptosis. Next is perforation of the globe. Perforation of the globe. And it may be due to the optic nerve atrophy. There is optic nerve atrophy. Optic nerve atrophy as well as the oculocardiac reflex. Oculocardiac reflex. And there can be accidental intravascular injection. There may be accidental intravascular injection. So this is of a LA, that is a local anesthetic. Next is a trigeminal nerve block. Trigeminal nerve block, then comes the respiratory arrest as well as the acute neurological pulmonary edema. So acute neurologic pulmonary edema. Next, these were the complications. Now let's move on to the contraindications. Where is it not indicated? This is in terms of the bleeding disorder. It is contraindicated. Bleeding disorders because of the increased risk of the retrobulbar hemorrhage. Next is high myopia. There can be high myopia. So high myopia if the axial length is greater than 25 mm. So axial length being greater than 25 mm, and then the sclera would be thin and which could increase the risk of the globe perforation. So in such case, the sclera becomes thin, and this increases the risk of globe perforation. Next is the open eye injury. Open eye injury or the penetrating injury. So open eye injury or penetrating injury is the injection of the local anesthetic behind the globe. So inject the local anesthetic behind the globe, and it could increase the intraocular pressure, and this could increase the IOP, that's the intraocular pressure, and this could lead to the extrusion of the orbital contents. So extrusion of the orbital contents. To learn and grow daily like this, please do subscribe.